Hi, I'm Connor. I'm bi, both polar and sexual, and identify as he, him, have ADHD, depression.
I am a 51-year-old black female, educated, master's degree, mom, accountant, businesswoman.
I will be voice acting for a participant. Straight, trans man, he, him.
My most memorable bad experience with the healthcare industry had to be speaking to my doctor about depression. Basically, they just didn't really care, wrote off a prescription, sent me on my way, and it didn't really do anything for me. It didn't address my problem.
My most memorable bad experience with a healthcare worker was with my dentist. I went in to get a wisdom tooth pulled. Actually, it's two wisdom teeth, and he went and had his assistant give me the numbing agent. But once they finished with the numbing agent, I could still feel every bit of pain that was happening to me when he was pulling my teeth. When I asked the doctor to stop, that I could feel it and that it really hurt, he said, "Oh, stop. It's not really hurting you. You really can't feel any pain. You're numb to the pain." I was like, "No, I really can feel the pain."
The most memorable experience I've had with a healthcare provider was when I was about 10 years old and had been hospitalized yet again for chronic stomach issues. Instead of trying to fix the problem, they had psychiatric professionals come and talk to me and basically made me feel like I was insane and that my lifelong stomach problems were all in my head. Eventually, they found out that I had ulcerative colitis.
I felt pretty dismissed.
Dismissed.
I felt very defeated after my encounter. I felt like I was stuck at a dead end and began wondering if I had actually somehow made up all of these issues.
They could have taken more time to address the problem, or at least listen to what the problem may be and look for a root cause that may help with the treatment.
My doctor could have acknowledged my pain and asked his assistant to make sure that she gives me some more numbing agent, and he could have asked me how I felt and how I was doing.
Something that could have been done differently was my providers actually listening to me and doing tests that they should have done from the start. Instead, they focused on something unrelated to my issues.
This is Kathleen Martin. I'm a registered nurse, and I am talking about a situation where I was an advocate for a patient. This patient was a 50-some-odd-year-old male. I'll call him S, and he would be admitted to the hospital with congestive heart failure. He had a weak heart muscle due to past drug abuse. He would be admitted to the hospital with incomplete congestive heart failure. He would be stabilized. He would be set up with a follow-up appointment with the cardiologist and sent home with 30 days of medications. Then he would not show up for his appointment, not return phone calls, and end up back in the hospital anywhere from 4 to 6 months, back in congestive heart failure. And unfortunately, this is a pattern we see quite a bit. But with this particular patient, he seemed as though he really understood the disease process and wanted to get help, but he would continue not to show up for his appointments. And I just couldn't understand. So I think this was like a third admission where he was readmitted, and I said, "S, please explain to me why you never show up for your appointments. Please explain to me why. I don't understand why you're not showing up. You say you're going to come and you are going to take your medications, and then you end up back in here." After probing, he admitted that the reason he did not come to his appointments was because he lived in a bad part of town, and in order to get to the cardiology appointments, he would have to take 2 buses and a train. A lot of times if his appointment was scheduled, say in the afternoon, it would be dark by the time he'd get home. He didn't want to be outside at night. It was dangerous. So he just wouldn't come to the appointments. So I explained this to the cardiologist. So he started making phone calls to try to find a cardiologist closer where he wouldn't have to take 2 buses and a train to get there, and found one near his home, just one short bus ride away. Called the cardiology office to see if he could get in for a follow-up. They weren't accepting new patients, but we just kept telling the story to the cardiology office and saying how much this patient needed follow-up, and this was the only way it was going to happen. And without this, his condition was going to continue to get worse, and he very well may not live past another 6 months or a year. The cardiologist finally agreed to accept the patient, and I'm happy to say that we didn't see him anymore after that in the hospital, because he was following up and taking his medications. Had we not pushed to find out the reason why he wasn't following up, I don't want to even think what would have happened to us. So it's very important to dig and try to find out what really is going on with these patients.